That's pretty good.
4, 5.
Good for him.
Do we have quorum with 5? Melanie? Oh, there we go. Wayne and Emily just joined online. Perfect.
I'm here.
Okay, perfect. Okay, let's go ahead and get started. Are we live stream? Okay, perfect. Good afternoon, everyone. I'm calling this meeting to order. This is the Thurston County Board of Health. Today is Tuesday, February 10th, 2026, and it is 3:46 p.m. This meeting is being held in person at the Atrium, 3000 Pacific Avenue Southeast, room 110, Olympia, Washington, and is also accessible via Zoom. This meeting is being live streamed. So before we get started today, I want to go ahead and do a round of introductions. We have 2 new Board of Health members joining us today, and so hoping that we can all introduce ourselves, and then I'll give the floor to our 2 new members. So I'll start with on Zoom, and then we'll go to those here in the boardroom. Commissioner Fournier.
Good afternoon. My name is Wayne Fournier. I am Commissioner for District 4. That's the large kind of rural district that goes from Tumwater to Lewis County and then from Rainier to Grace Harbor.
Thank you. Commissioner Klaus? Okay. Board Member Peters? Is that you on the iPhone? Maybe not. Okay, I'll go to those in the boardroom. Board Member Canadel?
Hi, Heidi Canadel, a licensed mental health counselor and member of the Board of Health.
Vice Chair Newton?
Hi, my name is Perla Newton. I'm a registered nurse and I'm a Board of Health member.
And hello, I'm Carolina Mejia. I'm a Board of Health member, also Thurston County Commissioner, and I serve as the chair. And then I'll pass it to County Manager Hernandez.
Thanks so much. Leonard Hernandez, Thurston County Manager.
Joshua Cummings, Assistant County Manager.
Barbara Valona, Health Officer.
Melanie Bruno, Board of Health Clerk.
And Jen Freiheit, Director of Public Health and Social Services.
And so we have Dave Watterson as well as Kim Coombs. And so Dave, we'll start with you and then we'll pass it on to Kim.
Okay, I think most of you were here last time I came in. My name's Dave Watterson. I'm from Tenino. I am here representing the South Thurston small cities as part of the reorganization. I have a lot to learn, I understand, but my background is in firefighting, so I was an EMT firefighter for 30 years. So I did see a lot of things that happened in the field. That was 12 years ago, so things may have changed a bit since that time, but I do have some idea kind of what happens out on the field. And yeah, like one of the things today that just caught my eye was isolation and how that affects people. And I know in rural South Thurston County, you have older people that have mobility issues, and with our food bank used to deliver a lot of food to them, and check in on them. And with all the things going on with food banks and funding, they're struggling at being able to reach out to those people. So just things like that you see in probably all over Thurston County, but I see it even in South Thurston County. So I'm happy to be here. Look forward to working with all of you and learning more about the Board of Health and what we do.
Dave, you're from Tenino, but you're also the mayor, right?
I'm the mayor, yes. Yeah. Little piece, I'm sure you know.
Kim?
Good afternoon. I'm Kim Coombs. I am the Chehalis Tribal Health Director. I have been in tribal health for 28 years. So I worked a long time with the Pacific County Health Department, working side by side with them when I worked at the Shoalwater Bay Indian Tribe. So I'm looking forward to sitting on this board.
Great, thank you. Okay, so we'll go ahead. We're very excited to have you. Walking in, we have Commissioner Emily Klaus. Is there an approval of the agenda for February 10th, 2026?
Make a motion to approve the agenda for February 10th.
Second that motion.
Okay, it's been moved by Board Member Watterson, seconded by Board Member Knadel, and any discussion? Hearing none, I'll call for the vote. All those in favor say aye.
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 Aye. Anyone opposed? Nay? Okay, the agenda is approved. Next is the minutes for our previous meeting, January 13th, 2026. Is there a motion to approve the agenda?
I move that we approve the agenda.
Second?
I'll second.
Okay. So it was moved, a motion to approve the minutes for January 13th, 2026 was made by Board Member Knadel, seconded by Board Member Watterson. Any discussion?
Chair, point of order, I think that we misspoke and the motion was actually for the agenda, not the minutes. So we might need to restate the motion.
Yeah.
I move that we approve the agenda.
The minutes.
Or the minutes. I'm sorry. Yeah.
I'll second that.
Thank you. So we'll go ahead. Is there any discussion? Hearing none, I'll call for the vote. All those in favor say aye.
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 Aye. Anyone opposed? Okay, minutes are approved for January 13th. Okay, and so today we have a very exciting proclamation, and I'm going to ask if we can have George Sharp as well as Rodney Yakton to join us here. And we are doing a proclamation for National Donor Day. And so Dr. Freiheit, pass it over to you.
Yes, and very special that this was chosen, and so we have two fabulous community members that are going to talk about their experience. So I will turn it right over to George to start, if that's okay.
Thank you very much. Hello, Board and Chair. Thank you for having me here. Especially thank you for honoring National Donor Day this Saturday. As most of you know, it means more to me than, it's just a miracle that I'm here. And so my story is that I got sick in 2020 and I almost died in 2023. And it was like a roller coaster ride for 3.5 years. I got put on the transplant list. I got a donor. That donor got disqualified 2 weeks before the surgery. And so that was very devastating. And then another donor came forward. And so thankful for Diane Weaver, who was the Rochester Grand Mountain president of the chamber, who stepped forward after a year of testing, was able to do and be my donor August 21st, 2024. And it's gone amazingly well since then. And so thank you for honoring that. And Thurston County, I think you know, probably 400 people prayed for me in this county. And you and Ty came to my hospital room, and the support I received was just totally amazing. And the days that I were really down, you guys kept me going, so thank you.
Rodney?
Good afternoon, everybody. My name's Rodney Uchten, and I'm speaking about my father, Melvin Uchten. Back in 1998, his health was dwindling, and it was his congestive heart failure. So we had some struggles, couldn't get him approved to be on the list for heart transplant. And thanks to Stan Speaks, at the time was the superintendent of Bureau of Indian Affairs in Portland. And he had set up my father to be our father. I have 6 brothers and sisters, I'm sorry. But we had him go through some testing, and he was approved to be on the list with the University of Washington. And it took a while for them to, things to start moving, but he was patient, and his health was getting weaker, and his skin color was getting gray, and by keeping our faith, keeping our belief in our prayers to be answered, we have had a phone call from the University of Washington, and we live down in Oakville. He had a donor, and it was a 24-year-old Alaskan native that had passed, and so he was the donor for the heart for my dad. So at 2000, May of 2000, he went into surgery, and they did a heart transplant. It took 6 hours to do the heart transplant. He recovered in his room, and then shortly thereafter, they had him up and walking. And it's just amazing how miracles do happen. And it's just having faith, keeping faith in God, and having prayers, and your prayers do get answered. And so it's just a real blessing. Dad he was 65 at the time, and he's still alive. He's 91 here next month.
That's good.
So we've had 26 years additional life with our father. And it's just his storytelling and these things that he's sharing now. And it's quite funny sometimes when he talks about somebody and just, uh-oh. But it's just a blessing to have different things that happen. And last month, December, he had an appointment. It was his last appointment, and his heart doctor told him that, Mel, you've been through a lot of things here. We've tested you and make sure your heart was working, everything's okay with you. And we're going to say you graduate from the University of Washington Hospital. And there's nothing more that we can do except for you to enjoy your life. And we thank you for everything that you've done to help us with our transplant hospital. Thank you very much for sharing.
Thank you. And on page 7 is also a little bit more statistics and stories in the packet. Just past the proclamation.
Yes, thank you, and I thank you, both of you for being here today. I'll open it up to the Board of Health members. Is there anything, any comments that you have before we start with the proclamation?
I'll share.
Go ahead.
Thanks, Chair. I just want to thank you both for coming and sharing your story today. When we decided to put this proclamation on the calendar this year, I was really looking forward to hearing both of you come forward. And I think we already kind of had some ideas on who could come speak because your stories are so well known in these circles that we're in. And so coming and speaking about it, also when people listen to this meeting, they can feel the hope, they can feel the inspiration, because you were willing to share your story. So I just really appreciate you coming in, and it's been an honor to hear both of you talk about your experience and your father's experience. Thank you so much.
Thank you.
Yeah, on that note, I would really like to thank you guys for sharing. It really means a lot. I'm actually on the other side of it because as a donor, as a assigned donor, I've talked to my family about my wishes. And as an ER nurse, I've called the number on patients who meet qualifications and gotten the team assembled for such instances. So we never hear the ending, so thank you for sharing.
Thank you both. I'll just kind of echo what, the board members have said here, that it really takes moments of you sharing your stories, knowing, right, that it takes a community and a community coming together. George, I remember when there were call outs, right? Is there any donors in our own community? And knowing how many people stepped up.
I should share that Gary Edwards was the first person to step up. We called University of Washington, they said, I'm sorry, but you're too damn old.
Thank you, George. But as you say, it takes a community of people stepping up to that. And, I know, George, the role that you bring and the role that your father brings, right? And the lives they impact, they're so important. And so just a very important recognition. I'm not seeing any more comments, so I'll go ahead and move into the proclamation. If we can start with Heidi.
Proclamation, National Donor Day, February 14th, 2026. Whereas National Donor Day is observed on February 14th each year to recognize the critical role of organ, eye, tissue, and bone marrow donors in saving lives and improving the health of individuals across the nation, and to raise awareness about the critical importance of organ donation to support those in need of life-saving transplants. And
whereas in 2024, more than 48,000 transplants from 24,000 donors were provided nationwide, while over 100,000 people remained on the national transplant wait list, of whom nearly 60% were from multicultural communities, and
whereas as of January 1st, 2026, the United Network for Organ Sharing reports more than 3,000 patients residing in the Pacific Northwest are on the organ transplant waitlist, of whom 1,572 reside in Washington State. And
whereas National Donor Day also honors the memory of those who have passed while celebrating the generosity of those who have donated, as well as the incredible work of healthcare professionals and organizations dedicated to facilitating the donation process and saving lives. And
now therefore be it resolved, the Thurston County Board of Health proclaims February 14th, 2026 as National Donor Day in Thurston County and urges community members to consider becoming organ donors to save the lives of others in our community and beyond.
So this is adopted this 10th day of February 2026 by the Board of Health. Thank you. And so if we can, if you'll join us in taking a quick picture, and then we will come right back. So we will, on the stairs, yes. So we will take a pause for 3 minutes.
follow us out here.
You want to turn the video on? In here? On Zoom? Thank you. Okay, so we are back. Thank you again to George Sharp and Rodney for joining us today and sharing their stories for that proclamation. And next on our agenda is an opportunity for public testimony. And we didn't have any signups, so I'll do a call out. Is there anyone here interested in making public comment? Do we have anyone on Zoom? Okay, so I will not go into the public comment spiel. We'll go ahead and move on to our health officer and director report.
Okay. So I've provided here the kind of a similar format as last month with our respiratory illnesses. They're rising and pretty high. I don't think that's very surprising. There is some wastewater data there about RSV, so you can see that it goes along with when RSV is also rising in the ED. So sometimes that can be predictive. I'm not going to talk too much about measles, but I did want to just update those numbers as of yesterday. So I'll say last year we had just over 2,000 cases in the United States. So far this year, we already have 733 in the States. And then in Washington, last year, we had 12. We already have 9 this year. So it's gonna be a record-breaking year. I think that's safe to say. And then the only other thing I wanted to do was look at this graph with hepatitis B, because I think if you just glance at it, it doesn't make a lot of sense. But I think it's very good. It's a very good visualization to show the effect of universal infant hepatitis B vaccinations. So you can see the solid line going from left to right across time is the case rate for hepatitis B in children 1 to 9 years old. And you can see it drops precipitously over time. And that coincides with the vaccine coverage rate going up. That's in the dotted line. So we had mentioned hepatitis B last month, so I just wanted to follow up with that image. And then there are some numbers there about pertussis, but I'm thinking I want to get some more, like a visualization to better show how that has changed over time. And I did put one comment in there about the Nipah virus because it was in the news. And it's funny, I don't always know what's in the news. It is an emerging disease and it is concerning for that reason, very high mortality. But there were 2 cases. So it's not that, you know, like this is the next big thing. It's just the thing that we're paying attention to right now. Any questions about any of that or some of the things I didn't talk about?
Questions? I do want to say thank you for covering the emergent disease, because I'd heard about it too, and I didn't know exactly how, you know, if it was going to be something that was going to be widespread or what was kind of, you know, what you were hearing. So I appreciate that being covered.
When I have what I have written in there is that this isn't even a we haven't seen it in the news before, but it's not unusual to have a handful of cases here and there in some countries. That doesn't mean it's not scary, but I'm not sure why the news cycle just really picked it up and ran with it this time around. So yeah, the WHO is following those.
And just out of curiosity, on the RSV wastewater concentration levels, that gap of data, is that from?
That, so it's not a gap.
Oh, okay.
The data is 0.
Oh,
yeah,
okay.
Yeah, they didn't, and so that is, you know, we follow wastewater primarily, like we started following it once COVID tests became really available, and then there was no way for public health to know how many people have COVID, right? Unless they were in the hospital. And so it was nice to be able to watch the wastewater data so that you would have an idea of exactly, you know, a little more of an idea about what's happening in the community. And so now that's expanded to a lot of other illnesses, including RSV. And it actually does fit very much with our ED visits as well. So there was a gap there where there weren't many cases, but there was no finding in the wastewater.
Okay. Thank you.
Any additional questions?
I would just like to call out on the last page, which is page 10 of 29 in the packet. We just had a really successful department win on our Black Lake pollution identification and correction project. It was a very large outreach, educational, and enforcement effort that we have brought owners into 83% compliance of all owners. So just wanted to point that out because that is a huge win for our department.
Significant. Well done.
Thank you. And I also kind of want to highlight the community activities that are spotlighted, support groups, holding space, a support series for parents navigating pregnancy loss is starting in February 2026. And so the department will be offering a free 6-week in-person support series that offers a safe, gentle space for parents who have experienced any type of pregnancy loss, including early termination, miscarriage, or stillbirth. And that is ongoing from February 5th to March 12th, 2026. It's Thursdays, 5:30 to 6:45. The drop-in lactation support group, February 24th and March 10th from 10:30 to 12 p.m. And the Together We Parent Support Group, which is now online. And it's the third Wednesday of each month from 10 a.m. to 11:30 a.m. There is a workshop, and I do recommend this for any septic owners, which is the homeowner septic self-inspection certification. Registration is required, and that is from February 27th and 28th from 9 a.m. to 1 p.m. There are some events. It's Screenagers Under the Influence. It's a community presentation, and it is on February 26th and the 27th. The 26th, it's at 6 p.m. at Providence Behavioral Health, and February 27th, it's at 6:30 at George Bush Middle School Library. And Thurston Mason County Development Disability Resource Fair, which is March 19th, from 4:30 to 7 p.m. at ESD 113. All of these are available on our Public Health and Social Services website, but wanted to highlight those for any members of the Board of Health, as well as any members of the public who are interested in joining us. Okay, thank you. Any questions for before we continue on? Okay. Next, this is our Social Connectedness and Prevention of Isolation Campaign update. This is a year in review, and we do have some guests with us today. Brian Windrop he's the Executive Director for the Senior Services for South Sound. So I'll ask him to join us. And was Cheryl Haywood able to join us?
No,
Okay.
last minute wasn't able to attend, nor Kyle.
And Kyle let me know he couldn't make.
Right.
Okay, Brian, so you're, it's on you. So there is a presentation. Dr. Bright had passed it over to you.
Yes, just a few quick slides, and thank you for this today, because we realized when December came and left, we were 1 year out. So we're 1 year and 2 months out from giving an update. This was a promise when we declared social isolation and loneliness as a public health crisis, that we would come back in a year's time and talk about what efforts happened toward that declaration, separate from a proclamation in December of 24. So just a couple of slides, if I could advance, and I'm so sorry. Cheryl did provide 2 slides, and this first one is really talking about the various events that the library had, which shows the number of attendees that they had at their events. So it includes about the Anywhere Library Mobile Services, their visits and their events. And then they also had a welcome wall at the libraries. So these were smaller efforts to really help with that social isolation and loneliness right within the libraries. And then the second slide was around those, the podcast, the Moving Forward Together Summit that they held, and the number of people that were registered, and 109 YouTube views. And then the podcast that our own staff, Elizabeth Hawkins and Mr. Brian Windrow, participated in. And that had 295 YouTube views and several more Spotify and Apple podcast views. So these were all around the topic of social isolation and loneliness. Then I just wanted to point out, on the Public Health and Social Services website, we do have a list of volunteer opportunities. This is not all encompassing, but is a good resource place to start to get engaged in the community. And we just wanted to talk about, we created 2 social isolation and loneliness brochures, one for the more senior population and one for the rest of the population. Those are on the end of the table if you would like to grab any of those. We collaborated, of course, with the Timberland Regional Library and other partners, and integrated the discussion of social connection into our suicide prevention trainings, which was a new thing that we had started with our QPR training, certified trainers who are doing several of these trainings. And so they're, instead of just talking about suicide prevention, they're now adding the whole component of social isolation and loneliness into that QPR training there. And lastly, just a slide that gives some of the demographics of all the social media that we did through the Public Health and Social Services website, the number of views, the number of shares, and we'll continue those on and repeat those as well in 2026. So those will continue forward. And we also have the website that we developed as well, the Social Connectedness and Prevention of Isolation website. So you can see any of those statistics there. So those were just some of the efforts that we did as far as the health department. But I'll turn it over to Brian to talk a little bit more about the collective efforts in the community.
Thank you. And I'm sorry that my colleagues weren't able to be here and speak for themselves. I'll do my best. Thank you for the opportunity to be here, Chair Mejia and council members. I'd like to start with appreciation for your public service in public health. It means a great deal to me, though I don't sit on this board, just as a citizen of this community. Thank you. So as Executive Director of Senior Services, it's our mission as an organization to enhance the quality of life for people as they age, or as we age, because we all do. And the work that this county did, that you all did to establish the declaration has been tremendous, really. It's not that if you understood who we are, that it changes what we do, but it has changed how we do what we do, and that matters. It matters a great deal. I brought a copy of our new strategic plan with me, and it has gone from being a theme that we had of our work to now it's one of our keystones of our strategic plan is to battle isolation and loneliness. And if I could, I'd like to read to you, there's 3 goals within that. One, for my organization is to maximize current programs to address isolation and loneliness. The next goal is pursue new programs that effectively address older adult isolation and loneliness. And the third is lead and partner with other organizations to raise awareness and inspire actions that address isolation and loneliness. So all 3 of those things matter a great deal. There are regular gatherings of nonprofit executive directors in this community. You should know that, just as some small part of your brain. We gather, in fact, we're gathering this Friday, and it's the executive directors of many organizations, the leading organizations that you could all name. We gather to partner, we gather to support one another. As the saying goes, it's lonely at the top, so to speak. And so we can be honest with one another in a way we can't always be honest with other people. And we often talk about isolation and loneliness. In fact, there is no maybe better measure of success, the saying that success, failure is an orphan and success has many mothers. You've heard that? I prefer to say mothers, not fathers. But anyway, I've had a number of my colleagues in the nonprofit executive director community say to me after you took that leadership move, say, oh, well, I wish you'd asked me to be involved, because they recognize the importance of it to their organizations, to their missions, and to the community. So it has been an active conversation in the community, in the nonprofit community, very consciously since the proclamation. I keep declaration, thank you. And for many of us, like you saw with the library, it is who we are. It's why we exist as an organization, is to keep people from being isolated and lonely. In my case, older adults. So again, it's not that I can say we did 20 different new things, but how we do it, the consciousness we do it with, I would argue that consciousness makes all the difference. How you have an interaction around it. My organization hosts hundreds of people every day in Lacey and Olympia, delivering Meals on Wheels all around Thurston County and Mason County. The only human contact many of these people get is our Meals on Wheels volunteer drivers. And they are aware in a way that they weren't before about the health impacts of being isolated and lonely. And so I think, though it can be difficult to put your thumb on all the data you might like to see, and I understand that could be unsatisfying to you, I would suggest that you not underestimate the impact in less quantifiable ways that it has had among the leadership of Thurston County and through the programs that we operate, and with all of our staff, which combined we're talking about many hundreds of people who work on the front lines of social service in this community who are aware of this issue. So again, I'm sorry my colleagues couldn't be here, but they send their best wishes and appreciation for the leadership this county has shown.
Thank you. Thank you, Brian. Any questions from any?
Just had a quick question, being new on the board. I'm from Tenino, so I hear the same thing down there from our food bank directors, that their delivery of food is really oftentimes only contact a lot of these people have, anybody, and just being able to check in on them is a huge thing. I just was curious, is there anybody from South Thurston County that's working around this with you on this issue?
Well, the Thurston County Food Bank, John Ficker is their executive director. He was my board chair, so we have a close connection. He was my board chair when we did this work, and so he's well aware of it at the food bank. And as you know, the food banks have interesting jurisdictions, how they do and don't overlap.
That's my concern, that they're not, our food bank.
Yeah, exactly.
Is not closely tied, I don't think, with the Thurston County Food Bank, so I just wanna, I know it's an issue, so I'll talk to our food bank and say, hey, this is going on. I don't know if she's been involved in this at all, so.
Commissioner, I would be more than happy to meet with her, did you say her?
Yeah, it's a her.
Them, and walk them through how we got here, what we've been doing. I would be more than happy, really, make time in my calendar to do that, if that would be of any interest to them.
I'll just relay that to all the South Thurston County cities, that, this is something that's ongoing, if they're not aware of it, to get involved, because, it's a huge thing, I think.
You weren't able to be here, of course, maybe online, to know the conversations that happened, but just quickly that we know it's not a new problem. Of course, it's a very old problem, but it is worse now.
Yeah.
And it is not yet getting better. And the research around the health impacts is what really woke me up, and I think for many of us made a big difference. That's as bad for your health as smoking and diabetes. I mean, equivalent in impacts to our health as those things. So our consciousness has been raised in a way, and this county is, to my knowledge, is still the only county in the state that's taken this leadership position, which is a shame. Shame on them. So we've come a long way, and it's not a new problem. It's going to take time. But like the campaigns around smoking, which I'm a child of the 70s, I'm not ageist. I was born in '68. That's how old I am. So I grew up in the 70s, and I remember when those campaigns, we talked about that when this was being discussed, that those campaigns took many years to change public consciousness, and certainly had an effect on my generation.
We'll pass the word on to South Thurston County.
And on page 16, there is a one-page flyer that you're welcome to use to pass out as well too. So it gives a QR code, a little bit about the social media, and then that statistic that Brian talked about as the health effects equivalent to smoking. So,
thank you.
Thank you. Any additional questions? No? Okay. Thank you, Brian.
Yeah, thank you all.
Okay, our next agenda item is a resolution in support of foundational public health services funding. Dr. Freiheit?
yes, so this, several boards of health and boards of county commissioners across the state are passing such a similar resolution because our foundational public health services dollars are being threatened with the tight budgets that are happening around the state, and this one is particularly with the governor's budget. And so the request is, hopefully you have had a chance to review the resolution that was part of the packet. It's on page 17, and can discuss the passing of such a resolution that will hopefully help in showing support for this very important funding that helps fund many, many of our programs within public health and social services, and therefore helps the community.
And this is an initiative that WASALFA, which is the Washington State Association of Local Public Health Officials.
Correct.
Is helping push forward and gathering all these resolutions in order to show just the impacts that foundational public health has had in all of our communities. And so it is a very thorough resolution, and if there are no questions for Dr. Freiheit, I would welcome a motion.
I'll make a motion to approve resolution number H2 2026.
Second. Okay, it's been moved by Board Member Watterson and seconded by Commissioner Klaus. Okay, any discussion on this item?
I would just say this is such a huge thing for our communities, just being out in the field and seeing, people's lack of education and services is, I think, is just so critical for our community.
Thank you. Okay, I'll call for a vote. All those in favor, say aye.
Aye.
Aye. Anyone opposed? Nay? Okay, the resolution is approved. So all of our electronic signatures will be added and sent over to the Wasalfo representative. So thank you, Dr. Freiheit.
Thank you all.
Okay, next on our agenda is a very exciting item. And so it is our interviews for applicants for the Board of Health Youth Representative. And so before we begin, I do want to clarify the process for the public. So during this time, the meeting will remain open. It's an open public meeting. However, it is the county's established practice that interviews are not live streamed. So during the interview portion, the live stream will be paused. And once the Board of Health has completed interviews and is ready to take action, the Board of Health meeting will resume publicly and the live stream will be reactivated. So we appreciate everyone's understanding as we work to create a comfortable and supportive environment for our youth applicants. So with that, it is 4:26. We'll go ahead and pause the live stream. have a discussion afterwards on how to move forward with the youth applicants. So if Melanie will send out a doodle poll.
We can do that. Please also, oh, I'm so sorry. Please also save any notes. We will need to collect those at the end. So do save those and not lose them.
Yeah, that's what I would, whenever you, a suggestion, whenever you interview over multiple days, and especially if you have a lot of folks one day and then just one, be good to take a second or a few seconds and jot some notes down, things that will help you jog your memory as to, we heard a lot of wonderful young applicants. What a great place to be. There's so much interest, but tough for all of you who are making the decision.
Great. So please be on the lookout in your emails, please, for that doodle poll, and we will come back and go ahead and interview the 9th applicant. So with that, we'll go ahead and go back on live stream. Are we back? Okay. So being back on live stream, kind of the decision that the Board of Health has taken at this time is that we had a 9th applicant who could not make it today due to illness. And so we will go ahead, the Board of Health has agreed that we will schedule the interview at a later date. The clerk of the board will be sending out a doodle poll to Board of Health members to see the next available date, as well as the available date that the applicant has. And then after that interview, the Board of Health will have a discussion on a nomination for the youth representative. And so with that, we will go ahead and move on to the next item unless there are questions. Everyone clear on the process? Okay, it is 5:41 and we have the 2026 Board of Health proclamation calendar finalization. Does the Board of Health want to move this item to the next agenda in March?
Sorry.
And I just want to say, only 3 of us turned them in. So if you haven't, this is still your chance to turn in your nominations for proclamations. I know Jen over here is feeling it, but just given the time, I want to be respectful of everyone's time today. So if you have not turned in your proclamation, please go ahead and do so.
One last chance.
One last chance. This is third time. Third time's the charm. Yeah, third and last chance. No more after that. We'll go ahead and move the 2026 Board of Health proclamation calendar finalization to March. Since this is an agenda amendment, I'll go ahead and take a motion to move that item onto the March agenda.
I move to amend today's agenda and move the last item related to proclamations to the March agenda.
Is there a second?
Second.
Okay, it's been moved by Commissioner Klaus and seconded by Board Member Watterson. Any discussion on that piece? Hearing none, I'll call for the vote. All those in favor say aye.
Aye.
Aye. Okay, great. So for the open Board of Health discussion information sharing, we didn't get any submitted reports, but I do, before we adjourn, I do want to share a brief update. So in March, the Board of Health will be reviewing our bylaws as well. So as part of that upcoming decision, I want to note that staff and the Board of Health Executive Committee, which is me and Board Member Newton, have been having ongoing conversations informed by feedback we've received from some Board of Health members about how we structure our work. Specifically, we will be discussing the potential transition away from standing subcommittees toward a work session format. So goal of this shift would be to allow for greater connectivity among board members, a more inclusive participation, and deeper, more robust discussion on key public health topics. This is not an action item today, but we will be digging into this more fully during our March meeting And I just wanted to ensure that the full board is aware of the direction of the conversation. So we'll be having more conversation on that piece. I also want to thank all of the applicants for the youth representative role. I am just so incredibly proud of each and every one of the applicants who put themselves out there, filling out the application and then coming in and being interviewed. It really, hope for the future, man. And so just incredibly grateful for all of you for hanging in there. I know that we are over time. But thank you for, your attention to all of these youth applicants who came forward and for, being responsive to their questions. I appreciate that quite a bit because I know it takes a lot to put your name out there and put yourself out there in a very vulnerable way. So thank you. So with that, we've reached the end of the agenda. I will entertain a motion to adjourn.
Motion to adjourn.
Second.
Okay, it's been moved by Board Member Watterson, seconded by Commissioner Klaus. Any discussion?
No.
No, sir? Okay, we're adjourned. Thank you.
Thank you.
Yay.